Hello,
Hi.
my name is Dr. Punekar. I'm your MRCP examiner for today. What is your name?
I'm Dr. Guduri.
Okay. So this is a 22-year-old patient, Miss Layton. She has been referred to your clinic with a recent onset visual disturbance. Please examine her eyes neurologically.
Hello, Miss Lee. I am Dr. Guduri. I'm one of the doctors here. I've been asked to examine your eyes. Would that be okay with you?
Yes, no problem.
Can you see my face?
Yep.
Can you see the whole of my face?
Yes.
Okay. I'm just going to start with some, just looking at your face first. So just relax and look at me. Okay. So, may I just ask you to cover one of your eyes for me? And can you read the top line?
Clinical waste.
Okay, and now cover the other eye. And what about the bottom line here?
It should be disposed into bins with yellow bags.
Thank you. I'd like to assess her visual acuity with a Snellen chart formally. I'll just now shine a bright light in your eye. It shouldn't hurt, but it might be uncomfortable, but let me know if it is. Is that okay?
Yep.
Just look straight ahead for me. That's fine. Thank you. So I'm just going to test your visual fields now. So if you don't mind closing one of your eyes for me. Yeah. And look straight at my face, and I'll wiggle my finger and ask you if you can see it.
Yes. 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 No. No. Yes.
Okay.
Yes. 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 Yes.
Okay, and now cover the other eye for me. And again.
Yes. Yes. No. Yes. Yes.
Okay, and again.
Yes. 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 Yes.
Thank you. Thank you very much. I'd like to examine the back of your eyes now, if that's okay. Yeah? So I'm going to shine this bright light, and I'm coming quite close to you, but I'm not going to touch you with this fundoscope. It might be uncomfortable with the light, but it shouldn't hurt. If you want me to pause, then that's fine. So the first thing I want you to do, if you don't mind, just focus on a distant point over there, maybe this yellow box over there. Yeah?
Mm-hmm.
That's fine. And now I'm going to come quite close to you. Look straight at the light. Very good. And now look straight ahead as you were doing before. What I'd like you to do now is to look up for me. And now look to the right. Look to your left. And now look at the bottom. I'll just lift your eyelids. Thank you. We'll just move to the other eye now. And again, if you look at a distant point over there. Thank you. Look at the light for me. And now look straight again. Can you look up? Look to your right and to your left. And down below. I'm going to lift your eyelids. Thank you. what I'll do now is to test the movements in your eyes, if that's okay. So keeping your head still, I'd like you to follow my finger. Well, actually, let's follow this tip for me, okay? And let me know if you have any double vision. Keep your head still. Any double vision?
No.
You keep following it. And down. Bring it across the sides. To the bottom. Across there. And down the bottom. That's fine. Thank you. Thank you very much, Ms. Lane.
Okay, so would you like to present your case, please?
The only positive finding I could find on Miss Layton today is that she has got a bitemporal superior quadrantinopia.
Okay.
Important negative findings include normal fundoscopy and normal eye movements.
Okay.
So I think that what I'm worried about is that she has got a compression to the optic chiasm that's most likely to be inferior to the optic chiasm.
Okay.
And it could be a pituitary mass that's compressing onto the optic chiasm.
Okay. Well, that's good. Let's just focus a little bit on that. You mentioned that she has got bitemporal upper quadranopia. Okay, can you just explain to me in terms of the optic pathways, the optic tracts and the optic chiasma, as to how is this caused? Just explain to me, how does a pituitary adenoma or a suspected pituitary adenoma end up causing a bitemporal hemianopia?
So the cranial nerve 3 at the back of the retina will cross at the optic chiasm.
2, you mean?
Yes.
Optic.
The optic nerve crosses at the back, crosses at the optic chiasm before branching out into the parietal and the temporal lobe and ending in the occipital lobe.
Okay.
So at the crossover, any sort of compression would cause a bitemporal hemianopia.
Okay.
And if the compression is inferior to the optic chiasm, it would cause a superior quadrantinopia in the bitemporal area.
Good. Okay, let's just move on. You mentioned that this could be a pituitary mass. How are you going to confirm? What investigations are you likely to do in this lady?
So I think the diagnostic investigation would be to do an MRI scan of her brain, so that we can look at the pituitary gland in more detail.
Okay.
But there are other tests that we should do, like a formal visual field assessment.
Excellent.
And we should also do some blood test to look at the pituitary function.
Okay. What hormones are you looking for?
So looking at the LH, FSH, ADH, the thyroid stimulating hormone, and prolactin.
Okay, good. Let's just move on from there. Say, for example, this patient is now symptomatic with pathology, and you've confirmed that she has a pituitary macroadenoma. Do you know how microadenomas and macroadenomas are classified? What differentiates the two?
So it depends on the size. So anything more than 10 millimeters would be classed as a macroadenoma.
Okay. Well, you have actually confirmed that she has a macroadenoma, and she's already got symptoms. So the patient wants something to be done so that she might regain her sight, or at least stop losing further sight. So what would you offer to her?
So the definitive treatment for this condition would be neurosurgical intervention, which would be transsphenoidal approach. And we can also offer her some pharmacological treatment as well. Okay.
Do you think of any particular approach pharmacologically? Any agents?
No, I can't.
Okay. What about dopamine agonists?
Yes, we can.
Yeah.
Yeah.
Okay. Good. Thank you.
Thank you very much.